Okay, hello, nice to meet you again, sir.
It's good to see you too.
Yeah. Just give you a short introduce yourself. Very short, yeah.
All right, my name is Glenn Pierce. I am the Vice President for Medical for the World Federation of Hemophilia. We are a nonprofit organization based in Montreal who have 140 member countries that are part of our federation. And those countries are at all different types of development levels, from very progressive to countries that have very low economies and have a lot of difficulty in treating their patients with hemophilia. The WFH does a lot of humanitarian aid work in those countries and has been promoting the concept of improved treatment, including gene therapy for patients with hemophilia around the world. Myself, I have been interested in gene therapy for many decades for hemophilia and have worked in the field over the past 15 or 20 years, focusing on the development of gene therapy for both hemophilia A and hemophilia B. We are now at a place where multiple clinical trials are ongoing. 2 clinical trials are in phase 3 for hemophilia A, and 2 clinical trials are in phase 3 for hemophilia B. We are beginning to see results that are putting the factor levels in We are beginning to see results that are putting factor levels in patients within the normal range or the subnormal range, but ranges that are sufficiently high to prevent bleeding from occurring.
Okay, just a very short question about the Korean situation. That in the last year, the gene therapy is a very far story for Koreans, but in this year, there are 2 clinical tests in Korea for gene therapy. So many people are very excited about the gene therapy clinical trial. So what is your personal opinion to person who wants to gene therapy clinic trial?
I think it's important if one is considering a gene therapy clinical trial to look at the benefits and the risks of entering into a clinical trial. These are still experimental therapies, and while we have seen very little in the way of adverse events or significant toxicities, it's still early days, and so one needs to be sure that they're ready, not only for going into an experimental clinical trial, but for the amount of time that it will take. These trials are very intensive and result in needing to have frequent contact with the hospital over a period of many months to even a few years in order to generate the data to demonstrate whether or not the gene therapy works.
Okay, the next question is, I told you said to me before, the people who has an hemophilian child, the parents, they are very anxious to wait for the gene therapy. So is there any chance to get kids getting gene therapy?
Children will benefit the most from getting gene therapy for hemophilia, because if we can get to children before they begin having a lot of joint damage, then gene therapy will give them factor levels sufficiently high to prevent them from getting that joint damage at all. But it's still early days. Only adults are being treated now, and likely will only be treated until these products are approved. And then I would expect, assuming it continues to be safe and effective, that trials in progressively smaller children will occur. I think that trials will occur in 12 to 18-year-olds, and then if those are successful, 6 to 12-year-olds, and then finally younger children. The concern about using the viral vectors
Yeah.
that are now in clinical trials,
Yes.
AAV,
Yeah.
is that they may not last if cells are rapidly dividing and proliferating. And so young children
Yeah.
have livers that are going to go from a very
Right,
small
yeah.
size to a very large size, and that means that the cells within the liver, the
Yeah.
hepatocytes, are going to replicate themselves a lot. And we worry, based on animal studies, that the effect of the gene therapy won't last in them. Those are experiments that need to be done. We may be wrong about that, but we want to proceed cautiously.
Okay, thank you very much. And one final question not a question, but please, can you leave a message to the clinical team or the medicine doctors in Korea? Can you have any message to them?
Gene therapy for hemophilia represents the next paradigm in treatment. Eventually, hemophilia will be cured through gene therapy. I don't know if that will be in 5 years or 20 years, but at the rate we're making progress, the field is moving very, very rapidly, and it's important that all patients get access to the clinical trials and eventually, if they come to the market, to the drugs themselves.
Thank you very much. Thank you for participating in the interview. Thank you.